Dementia disease versus delirium versus mild cognitive impairments. What is the difference? Hi, I'm Bill Santa Cruz of Assisted ElderCare Placements. As per in-house research, all senior cognitive issues seem related to the 3Ds, of which this video will briefly distinguish between. Therefore, D1 will stand for dementia disease, D2 will stand for delirium adverse reactions, and D3 will stand for cognitive dysfunction, also known as mild cognitive impairment, or MCI. Okay, D1, dementia disease, of which most people simply call Alzheimer's. As per the medical community, this simply represents that the brain is failing from a degenerative and incurable condition. How and where it is failing determines which dementia disease label the condition will be given: Alzheimer's, vascular dementia, Lewy body, etc. And while the different dementia conditions come with identifiable characteristics, overlapping issues include amnesias that create short-term memory issues and long-term memory issues. And in a nutshell, these memory issues are the result of destroyed brain cells, causing derailments within the brain's memory recall system. In other words, these injuries not only begin to prevent the recall of memories, but this condition only worsens as the disease progresses. Okay, D2, or delirium adverse reactions. These are the usually temporary states of confusion and/or disorientations that seniors tend to experience with such things as pneumonia, urinary tract infections or UTIs, bone fractures, electrolyte imbalances, improper medications, etc. D2s may be referred to as pseudodementia and at times seem to be medically diagnosed as dementia disease. Again, as delirium adverse reactions are usually a temporary condition with no real brain injury involvement, proper care and overwatching usually enables the individual to regain cognitive normalness. However, these conditions may prove confusing to family and caregivers due to the in and out of disorientation roller coaster ride that often occurs prior to totally recovering from the condition. D3, or what might be described as mild cognitive dysfunction. The causes of these conditions are potentially numerous. They may be a precursor condition to dementia disease. They may be a carryover condition related to an adverse reaction delirium situation, or they may be a carryover due to an illness. They may be due to such factors as depression, anxiety, or fatigue, etc. However, because the issues associated with the 3Ds tend to exhibit themselves very differently, their conditions tend to be readily distinguishable from one another. However, and importantly, D2, or the delirium adverse reactions, can easily mask mild to moderate dementia disease conditions and mild cognitive dysfunctions. Now then, a simple way to distinguish the 3Ds may be as follows. D1, or dementia disease, may be likened to a computer with worn out or broken parts that simply do not allow for the recall of information. D2, or delirium adverse reactions, might be likened to a computer plugged in to an inappropriate but non-damaging power source. Therefore, the recall of information may be erratic. And D3, or mild cognitive dysfunctions, may be likened to a computer that seems unable to properly recall information from specific storage areas.